The first three tests I will be doing are for AC injuries. The first one is the O'Brien's test. So I will have my patient put his arms straight in front of him. We will go thumbs down first, and I'm going to gently put pressure, push down. No, you can resist me this time. So resist. Okay. Then you're going to rotate your hands so that your palms are face up. Going to push down. If there's pain or weakness with that, that would indicate an AC injury. The next test is the compression rotation test. So I'll have my patient bring his arm here and flex his arm. And what I'm going to do is push it across his body. If there's pain with that, that could also indicate an AC injury. And finally, we have the AC resisted extension test, which he will bring his arm back in front of him and flex his arms. You don't have to do that, you can just do it this one. So, and he's going to push here against my hand. Pain and weakness with that would indicate an AC injury. Next, we will be looking at impingement. The first two will be subacromial pain syndrome tests. The last two dealing with dealing with infraspinatus, teres minor, and also subacromial pain syndrome. So, the first one is the painful arc. So what you're going to do is you're going to raise your arms up above your head. Be careful of the fan. Just raise them up. And if he felt pain in between 60 degrees and 120 degrees of abduction, that would be a positive sign for subacromial pain syndrome. The next is the Hawkins-Kennedy test. So I'll have my patient bring his arm up, flex his elbow. And what I'm going to do is internally rotate. Here, face the camera. Internally rotate. Pain and apprehension with that would indicate a subacromial pain syndrome injury. The next test is the exertional rotation, or the external rotation lag test. So what I will do, I will passively, keep your arm by your side. I will passively externally rotate his arm, and then supinate his forearm by 5 degrees. And I will ask him to hold this position. And if this were to lag back towards his body, that would be or if there was pain in holding that position, that would indicate either infraspinatus and teres minor weakness or subacromial pain syndrome. And if that test comes back negative, we can do the external rotation strength test, which is just he will push against my hand. So push. And with that test, looking for pain or weakness, which would indicate infraspinatus, teres minor, or subacromial pain syndrome.